Hi, my name's Andy Biggs. Thanks for joining me. I'm the Congressman from Arizona's 5th Congressional District, and I have with me a special guest, Alex Berenson, who's done a yeoman's work informing the public about the COVID outbreak, our response to it as a nation, the policies that have been put in place. I just have great respect for you, and your courage and getting out there and doing it because I know if you're like me, every time you say something about some of the official policies that have been put in place that seem to contradict the science and data that's out there, you get wrapped on the head pretty good. So thanks for doing what you do, Alex. And tell me what's going on specifically with policies related to opening of schools, perhaps universities as well.
Sure. So, the schools, you sort of have to divide on a district by district, state by state, country by country basis. But the U.S. is the big outlier here. All over Europe, schools have largely reopened, and in many places, they've rolled back some of the, stuff that they tried to do when they were more concerned about transmission between students and the risk to students. In other words, places are getting rid of pods. They're getting rid of masks. I'm talking about, in countries like Germany and the UK. They've seen very low transmission of, student to student transmission or student to teacher transmission. And they've seen very, very few cases of hospitalizations, much less deaths. And so they've realized that it's very important to get the schools open and have them function relatively normally. I'm not saying they're completely back to normal, but they're well along the way to being back to normal. Meanwhile, in the U.S., most districts, certainly in most big cities, but really all over, are not reopening normally. They're reopening either completely virtually, so all remote, or some sort of odd hybrid program that still makes it impossible for parents to have any kind of normal, work routine. And to just show you how strange and Orwellian this has gotten, a lot of school districts are well aware that they can't, that parents are suffering from this. So they've tried to offer what is effectively daycare. They've said, we will have remote learning but we'll do it in schools. So your kids will come in to the school. You will pay us a couple $100s a week. We will provide, a space where your kids can learn, called a classroom, basically, but the teacher won't be there and they'll be learning remotely. And if that doesn't tell you, just how messed up things are right now, I don't know what does. Really, this has been a testament to the power of the teachers' unions and to individual teachers, a lot of whom are unnecessarily afraid. I mean, some teachers are at higher risk, but many teachers are at very low risk from this, and they're refusing to come in and teach. And I think administrators have essentially, whether it's because of liability or whether it's because they are afraid that if they try to reopen, so many teachers just won't show up that the school won't be able to function. Or whether it's political, and they're hoping that this will sort of damage the economy until November. I hate to think it's that, but none of these are good reasons to do this, or because they completely misunderstand the risks. We're in this place where the schools are not reopening in most of the country, and certainly for most big school districts, and that's just terrible for kids.
Yeah, and Alex, just two quick points on that. We had a school district in Arizona where they were set to open, but they couldn't open because the teachers did a sick out. They called in and said, we're going to do sick. So they couldn't open in person. And the other thing is that the CDC director said himself that the risk of fatality for a child is 1 in a million. And that would be actually the high end of that, the data point, actually 1 in a million.
Right. So 1 in 1 million children at this point has died from SARS-CoV-2 or from COVID. I think we still don't even know exactly what the infection fatality rate for children is. It's probably a little bit higher than that, but we just don't really know because it's so low. It's hard to measure accurately when you're kind of at that end of the statistical curve. But the teachers have. The idea that teachers are writing wills and insisting that they're all going to die if they come in. It's very disturbing, and I don't understand. I don't understand if they just misunderstand the risk so badly, or if this is political. But it is damaging our kids.
Yeah, no, I agree with that. I'm very concerned about our kids, how they're going. I mean, I'm not one to talk about socialization as well, but I mean the weird kind of socialization that's going on in our country for not just adults who are seeing their lives in upheaval, but for kids in particular who are trying to develop and go. And I mean, and so you see the numbers with regard to suicide ideation that
Yeah.
have been very high among adolescents. And it's everything you say. You're talking about populations that have very, very low risk, lower risk than the flu. So this gets to my other point I was going to make with you, and I forgot to brief you on this to see if you're okay with this, but I'm going to take it anyway. I'm seeing some of my colleagues on the other side of the aisle are already sending signals that when there's an intersection between the annual influenza epidemic and COVID, they're already talking about perhaps lockdowns, some more lockdowns. And you know, what are you hearing there, and what do you see there?
This is insanity. Okay, and by the way, again, the U.S. is the outlier now. Well, not entirely, because New Zealand did lock down again, and Australia, but it's so you know they're acting very odd too. But in Europe, there's been this, and cases in Europe have spiked in the last couple of weeks. Let's be clear about this. As they've come down in the Sun Belt, they've actually spiked in Europe. But in Europe, they've made a commitment. A lot of national leaders have made a commitment to no lockdowns. The idea, first of all, it's not even clear that there's going to be much of a COVID epidemic in November. I'm not saying there definitely won't be, but if you look at what's happened in your state, if you look at what's happened in the Sun Belt, is there going to be another spike? I'm not sure why we're so sure there would be when we had a big spike over the summer and it dissipated all on its own. But that said, we never locked down for the flu in the past. We never considered locking down for the flu. So right. What exactly are they talking about?
Yeah, I know. It doesn't make any sense to me unless the more malevolent intention is to have negative impact for political reasons or whatever. That's all I can figure, because it doesn't make sense from the science, from the data, from our practice, from our history. There's just nothing that would support that decision. So let's talk about the CDC. I mean, recently they've done a couple things and said a couple things, whether it's masks or testing for asymptomatic people. Tell us about that, and tell us about this inconsistency that we've seen for so long.
Sure. So, the two big changes the CDC made recently, they said essentially no need to quarantine if you're coming from anywhere. And they also said no need for asymptomatic testing, even if you've been exposed. And what's very interesting is those recommendations really contradict what the people who on what I sometimes call team apocalypse, what the hard Democratic governors say, what places like CNN say. Everybody needs to get tested. Test and trace is what's going to get us out of this. We need 1 million tests a day. We need 5 million tests a day. We need 20 million tests a day. And here the CDC is essentially saying, if you're not sick, you don't need to get tested, even if you've been exposed. And you don't need to quarantine either. The mask issue is slightly different, and I kind of want to put that to one side right now. But what's so fascinating about this is these people all like to say, we follow the science. We're doing what the science is, which has not really been true from the very beginning about this. But here's an example where the CDC has made recommendations, and because these people don't like the recommendations, they're saying, we're not going to follow this. Governor Cuomo or Governor Newsom, I'm still going to make you, quarantine if you go somewhere, which is absurd. Okay. It's unenforceable and it's absurd, on a practical basis. And I've talked to people who've talked to these contact tracers, and it's almost silly, the game that's being played here, but they're still doing it, even though the CDC said no. And, and all these places are still saying, well, go get yourself tested. Localities are saying that, and the media is saying that. Well, okay, the CDC now looked at the science and said no. And if you sort of think about what those two things say, they say something very important. What they say is the CDC is kind of backing down from the panic. right? They're treating this more like the flu now, more like a regular virus, not like the end of the world. You don't have to get tested if you're not sick. Well, that makes total sense if this thing is not that dangerous. You don't have to quarantine if you come from a place that, you know, where there's been cases, more cases than your home state. Okay, that's because who really cares if you've gone to that state and come back? I mean, the CDC will never come out and say that, because doing so would be, you know, politically impossible, and I think it would raise a lot of questions about what's happened in the last 6 months. But that's clearly the direction they have moved with these two recommendations, and that's why the people on the panic porn side, on the team apocalypse side, hate them so much.
Yeah, I mean, that's, I find it very, I actually had, I was doing an interview with a talk radio guy yesterday. He said they're was it COVIDiots or something? I guess is the way he refers to these folks. But,
well, each side calls the other COVIDiots, which is sort of funny.
That's it. Yeah, so I'm a COVIDiot too. Yeah, so it's unfortunately, you know, without getting into it too much, it's unfortunate that it seems to have been politicized from the very beginning here in this country, and that's a crying shame, because I think the data and the science were pretty clear. We knew some things at the beginning. We knew that there was a particularly vulnerable population.
Yes.
And our policies didn't really reflect that in some ways. So, well, so you wanted to set the mask thing aside, but the CDC, what they said is wearing a mask during prolonged exposure to coronavirus won't prevent possible infection. And then for them, prolonged exposure is within 6 feet for more than 15 minutes.
Yes. So I actually, you know, I published this on Twitter a couple of days ago because a reader actually sent it to me. This recommendation's been in place for a while. It's not a new thing.
Right.
But the idea is, you know, this idea, well, my mask protects you and maybe it protects me too, and everybody's mask protects everybody. Meanwhile, the CDC is actually saying you're considered to be exposed whether or not you're wearing a mask, and whether or not the person who's sick or has COVID or, you know, has SARS-CoV-2 is wearing a mask. So they're saying, from their point of view, the mask is useless in terms of judging exposure. So once you know that, the question becomes, who is the mask protecting? The thing about the masks, and, you know, I think we've talked about this in the past, is masks, on the one hand, are relatively low-cost intervention. In terms of sheer cost, they are certainly less expensive than lockdowns. But they are not low-cost societally, because they set the stage for other interventions, and they say to people, this is a dangerous, you know, this is a really dangerous time, and you have to wear a mask because this is so much worse than the flu could ever be. They give people the wrong idea about the risks, and they're a way for the government to impose pseudoscience on people, because there's very, very low evidence that masks do anything good. But so the reason the masks have become, I think, a bigger deal in the last couple of months is when you look at your home state, you know, you look at Arizona, or you look at Texas, or you look at Florida, and you see this spike came and went. And yes, there were some deaths. Let's be clear, people did die, but the hospitals did not get overrun. And in Arizona, you know, hospitalizations are now down more than 75% from where they were more than a month ago. We are through this in the Sun Belt. And the Sun Belt did it without lockdowns. The people who were screaming that in June and July that we needed lockdowns need an excuse for why this happened. And their excuse is masks. Masks did this. Masks saved us all. And that's, oh, and also we closed bars. So apparently all we had to do to stop COVID was close some bars. So, I mean, you know, so that's why these people are insisting that masks made the difference, despite the fact that when you look, again, you look globally and you look at the hard scientific evidence, previous studies, randomized controlled trials around masks, there's no evidence they work. And so when people say to me, you know what, like, why do you have to fight about masks? You know, I'll believe you about lockdowns, but can't we just wear the masks and be done with it? The answer, unfortunately, is no, we cannot.
Right. That's right, Alex. I'm with you, and you say it so well. That's why I enjoy listening to it. But hey, so the last question really to cover here is I asked this because I don't see it. What is the exit strategy? Where do we go from here? I mean, and I don't see it an exit strategy.
Well, I mean, you're the one in Congress. You're the one who's got the, you know,
That's my point, Alex. I don't see it in Congress even.
Well, I mean, if it's not funny. The virus may be making its own exit strategy. Mm-hmm. Okay, if you look at what's happened with cases and deaths, you know, they're going down again. And if you look at Europe, again, cases are up, but deaths are not way up. And, you know, the US, we've been counting deaths incredibly aggressively. We've been doing this database matching where anybody who dies, whoever had a COVID test, winds up in there. You know, we've really pushed. I would like to think that at some point the fiction that this is, you know, is so damaging that we have to, you know, take these extraordinary measures, people will look at the data and just say, it's not true. I mean, but I don't know. The counter argument, and I get emails all the time. I get emails from so many people. Somebody says to me, email me, and he said, look, I totally agree with you, you know, and I look at the numbers and I see that, you know, that we're past the worst of this and all the rest of it. But whenever I try to tell people this, they just say 180,000 deaths, 180,000 deaths. And it is true. That number is used as a cudgel to, you know, to make it sound as if this is an impossible problem. When nobody says, well, there's 500,000 preventable deaths from cigarette smoking every year, and we don't, you know, we banned cigarettes. You know, sometimes, look, it's hard to say this because people will just say you're a ghoul and you're you know, you don't care, you're a sociopath. Almost 2 million people have already died in the United States this year.
Right.
A lot of people die in the United States. A lot of people die worldwide. It's a big country, and we have definitely reached the point where the dangers of what we're doing are much greater than the dangers of the virus. We're well past that point. I don't know how we convince people of that. I guess my hope at this, I mean, I've been screaming about this for 4.5, 5 months now. I guess on some level, the virus is just going to, I mean, it seems to be burning itself out. Now, I don't know. I hate to say that because if in 3 months there's another wave, people are going to say, Berenson was wrong and he said in August. There's no guarantee that's going to happen. Here's the guarantee. We're going to have to learn to live with this. Whether or not it's burning itself out right now, whether or not the deaths continue at this pace for a while, this is not something that's going to destroy our society unless we let it. And you know, that doesn't mean we shouldn't do anything. It doesn't mean that when there are spikes, we shouldn't stand up the hospitals. It doesn't mean we shouldn't try to protect nursing homes. It doesn't mean people who are sick shouldn't get tested. It doesn't mean, the most important thing we can do is tell people if they're sick to stay home. You know, don't cough on, you know, don't cough on other people and stay home. That's such a simple message though. Is that going to be enough to get us moving forward? I don't know. You're asking, I realize I'm sort of dancing around the question, but I don't have a great answer. I've been waiting for people to wake up for 5 months.
Yeah. And I have too. I think both of us were out there fairly early trying to tie this to data and science and how to approach this. And I have to tell you, and I'll close it out by saying I'm afraid that this has just become so political that even though we should be talking about an exit strategy today in Congress, we're not.
Right.
But after the presidential election, that's when you'll see an exit strategy.
Well, I mean, first of all, it depends on who wins, right? If Donald Trump wins, it stays political. I'll say two last things. I guess I've really become, you know, disillusioned about this. I became disillusioned about this in June, because in June, you know, it became clear there was going to be a push back against schools reopening. And then the president of the United States tried to put the power of the White House behind schools opening. Yeah. And it actually, not only did it not work, it actually threw more sand in the gears because somehow the issue became politicized. And I thought to myself, if we can't get schools reopened when all the science and data is on one side and all the European countries are doing it, and President Trump's effort to get involved has only made things worse, what's going to change? So that's the bad news. The good news, if there is good news, so I ran this poll on Twitter yesterday, or the day, I guess it was the day before, and I said, how many of you know someone, even one person, who's died from the coronavirus? And it turned out that 87% of people knew no one. And this was more than 30,000 respondents. This is now, it's not a random poll, but it's still a large number of respondents. More than 87% of people didn't know anybody. 96% of people didn't know more than one person. And 49 out of 50 people did not know more than one person under the age of 75 who had died from the coronavirus. So, you know, at some point, I would hope that reality just become, I mean, it's clearly become obvious to college students, which is why they're pushing back so hard against some of these restrictions. But at some point, I think, and I hope it becomes obvious. But you know what? We shouldn't have to wait for that. You're in Washington. I don't know if you're in Washington right now. You should be doing something about this.
Right. No, I agree. And so we, as you know, it's just trying to rev up the momentum so I can get enough votes to actually do something positive about this.
Well, good luck.
Yeah, that's right. And I haven't had that luck yet. Hey, Alex, thanks for taking some time with me today. Good luck getting the message out. I'll keep fighting my side. You fight your side, and we'll
let's keep in touch.
Yeah, absolutely. I appreciate all you're doing.
Thanks, Representative Biggs.